Hello, this is Dr. Kelly with Equitable Healthcare, and today we're going to discuss hyposexual desire disorder, health equity. Hyposexual desire disorder, HSDD, is basically quote unquote the impotence of women is normally caused by, or low sexual desire is normally caused by mainly four things. Number one is psychiatric medications. Number two is basically childbearing. Number three can be surgeries and such things as hysterectomy. Also, in number one, you can have OCDs, um, birth control methods can also cause HSDD. So that is the drug causing mechanisms of HSDD. The key to sexual health equity is preventive medicine. So basically, for women, preventive medicine is good nutrition, which for me, that's a green mind diet, green decaffeinated tea, Mediterranean diet, and the DASH diet combined, sleep, excellent sleep hygiene, and exercising. You must exercise, even if it's just twice a day, 5 to 10 minutes per day. Additionally, in a society where about 40 to 50% of the population is overweight and obese, exercise and good nutrition are just very, very important. And obesity is also can cause hypersexual desire disorder. Also, as previously mentioned, the three components: drugs, childbearing, with and surgery. Number four actually is menopause. So a lot of women who go through menopause and the decrease in estrogen can develop HSDD. As previously mentioned, it sounds easy, but for most women, they're in self-care deficit where they take care of everybody except themselves. And so self-care for a woman uh, is about 2 to 6 hours a day. Skin, meditating, whatever that is for you, and making sure you even eat right, spend the time planning the meals during the week, which would also the green mind diet, especially, definitely weight loss. I use a lot of nutrition for weight loss. Currently, the therapeutics for HSDD that I mainly recommend, medical cannabis works exceptionally well, and you have the female Viagra a D, which works well as well. For a D, you have to remove the underlying causes, which the psychiatric drugs, patients would have to do a pharmacogenetic test because that's a bad side effect once you go into hypersexual desire disorder from psych drugs. So the pharmacogenetic test would definitely gear you towards basically which drugs you cannot be on. And for the psych drugs, there is a lot of weight gain, 30 to 50 pounds, plus the hypersexual desire disorder. So once you start getting into these, what I call heavy side effects, that psych drug is just for your genetics. It's just incompatible. And that's why the pharmacogenetic test is so important. The poor man's pharmacogenetic test is to look at the drugs that the patient is already having side effects to. And normally these drugs, the P450 cytochrome system, that metabolizes these drugs, and drug profile in terms of the enzymes that's used to induce or inhibit these drugs. Normally the patient cannot be on any other a drug that utilizes these enzymes. So that's what I call the poor man's pharmacogenetic test. Ultimately, to basically slow down HSDD, the answer is really self-care. Again, as I mentioned, good nutrition, excellent sleep hygiene, and exercise. You know, you must, it sounds weird. I don't use exercise for weight loss. I just use it to keep you in a high endorphin state. Some women will have to go on hormonal replacement therapy. You know, I just basically use the Climara Pro patch for that, and then optimize the woman's endocrine system, thyroid, adrenal glands, and you know, try to balance out with light estrogen therapy like the Climara Pro patch, medical cannabis, bee pollens work well. So to develop, one should develop a comprehensive plan for this lady, for the patient, especially if the patient has the BRCA gene, the breast cancer gene, or a strong family history of breast cancer, ovarian cancer. That patient wouldn't be able to go on hormonal therapy. So I would recommend medical cannabis, the bee pollens. Bonafide is good. Acupuncture works really well, and foot detox ionic spas works well. So I just want to make sure women understand that you're not alone, you're not in isolation, and hyposexual desire disorder, low sexual desire disorder can be treated. And you know, the first approach and to head off the low sexual desire is really good nutrition, exercise, and excellent sleep hygiene, and just excellent self-care. And you know, see a specialist in women's health. That's very important, especially to do a deep dive into any endocrine issues. And as I mentioned, the weight loss, I mainly use nutrition. And know that, as I said, that there's help out there for low sexual desire. If anyone would like a consult with me for health and wellness, uh, please contact me via the description box below, and like, share, and subscribe for any of your friends that are suffering with low sexual desire. Have a great day. Thank you so much for your time, and live long and prosper.